Good morning, ladies and gentlemen. I'm just going to present a young boy who presented to us a few years back with sudden onset pain in the abdomen, shock, and he had a cardiac arrest in the emergency. We resuscitated him, did a CT angio, found to have a ruptured splenic artery aneurysm, and took him for an emergency surgery. And we found a splenic artery aneurysm here, which we ligated, and he survived. Post-operatively, with a young boy with aneurysm, so we thought we must check it up. What is there in the rest of the body? So we did a CT angiogram and found multiple aneurysms in his body affecting the subclavians, aortic arch, celiac artery areas, found to have right renal artery aneurysms, iliac aneurysms, and a subclavian artery, a huge right subclavian artery aneurysm, and a small ventricular aneurysm here. So after some time, once he got better, then we took him for a right iliac aneurysm repair, which is here. It's a huge one. And we put in an interposition graft with an open surgery, as you can see here. And we took him for a celiac artery aneurysm repair a month later. Sorry, should have worked. There's some problem in the videos here. Just a minute. So we can see it's a celiac artery aneurysm here, a small renal artery aneurysm. We took him for a wire from the brachial artery, cannulated the SMA here. And then from the groin, we placed a covered stent graft covering the aorta. And there is a small endoleak, which we left it alone. And on the check CT scan, there is a small endoleak, which was present in the post-operative period. And then we follow up the patients for another 2 to 3 months, and we did a check CT scan later on. And as you can see on the follow-up scans, the size of the aneurysms in the thoracic aorta has decreased by more than 50%, and the left subclavian artery aneurysm has also decreased in size. And 2 months later, we did another scan because patient was not filling for during this period for repair of the right subclavian because of financial constraints, and the aneurysm size has decreased further. So later on, then we took him for a right renal artery aneurysm because he presented to us with a right loin pain. So we took him for an urgent intervention. He has not ruptured there. And at the same time, we did a check scan for the previous aneurysm repair, and the endoleak in the celiac artery area has disappeared from there, and the right iliac aneurysm, right renal aneurysm was repaired. We discharged the patient, and we took the approval for right subclavian aneurysm repair on an urgent basis because it was quite big, around 12 centimeter. And next week, he got admitted. So on the night of admission, he ruptured his aneurysm, had a cardiac arrest in the ward. He was resuscitated and took it for an urgent subclavian aneurysm repair. We opened the chest with a trapdoor incision. We ligated the subclavian artery. There was no time for repair. And luckily, he survived with that. And we followed him up, and on a CT scan, he did well for 1 year. And after 1 year, in December 2008, he again presented to us with a small aneurysm in the right iliac, which we have repaired earlier, and you can see on the CT scan it was a huge aneurysm. So we thought we'll repair him next day. In the next morning, you can see the size has increased and it was about to rupture. We took him again for an open intervention and repaired with an interposition graft. And we did a CT scan at that point on a follow-up, and all the aneurysms in the left subclavian and the thoracic aortic aneurysms has disappeared in the last 1 year. So 2 months later, he again presented to us with a back pain, and we did a CT scan. We found that he has got an aneurysm at the level of just below the previous stent, at the level of SMA and the renal artery. We took him for a hybrid procedure now. So we took a graft from the infrarenal aorta, placed it into the right renal, into the SMA and into the left renal artery, and we stented that, extended the stent from the previous stent to cover that aneurysm. So we thought we have already won the game, so he should be fine. And we checked MR angiograms for 3 years, every 6 months to 1 year, and he showed no leak. So up to last August, we were very happy that he has been absolutely doing fine from 3 years. Aneurysms in the heart also settled, so we are happy. So he was always on the follow-up every 3 monthly. So he didn't show up for 6 months. So in this March, we called him up, where is he? So we could not get hold of him, we could not get in touch. Then suddenly he contacted us in the clinic one day. And we thought he must have died because he hasn't shown up for 6 months. So, but he survived. What has happened was he presented with a sudden onset acute pain in the abdomen in the local hospital. He was from Leh, so he could not come very often to us. And he had developed a renal failure. So he must have blocked all his graft, which we have placed. And all the doctors over there, they have stopped all his medicines, antiplatelets and everything. And today he has come to the clinic because he had developed a severe pain in the abdominal area for the last 3 days, which is not settling. So he was flown from Leh to Chandigarh. So anyway, we did a CT angio now, and we found that he has developed huge aneurysm just below the stent area, which we have done before. And both his grafts to the SMA and the left renal is blocked, and he's surviving only from one IMA. So this is the inferior mesenteric artery from just below the aneurysm, which is plying the whole thing. And this aneurysm on CT scan was around 2 centimeters in diameter, so it was quite a big vessel. So now we were stuck what to do. Anyway, we planned him for an urgent intervention again, and what we did was we opened him up, re-implanted the IMA into the left common iliac. Now this was a very tricky surgery because this was the only vessel which is surviving, and we have to operate him on an urgent basis. And so we just re-implanted the IMA here, and we stented from top to bottom up to here because there was an aneurysm here also and here. So sorry, this is the slide at the top. So there was a spinal artery here. So just below the spinal artery, we started the stent graft, and we placed 2 stent grafts, and you can see lots of stents in him from previous surgeries. And this is the end result which we have got with an IMA going from here and the stenting up to the infrarenal aorta. So he has been discharged 3 months. He is on follow-up. He is doing a maintenance hemodialysis through the left AV fistula. So let's see if he survives more. And so he has become a man now. So when we saw him, he was 16. So he's around 23 now. So all this effort is really worth it. When we see his father smiling, he is the only child of the family. And we could not find any such disease in the whole family before. Thank you.